Bismillahirrahmanirrahim. Hi guys, I'm Dr. Memuna. Uh, Vaginal discharge can present in different ways. As we all know that one of the most important reason for it is sexually transmitted infections. Now, when you're having recurrent vaginal discharge and it's not responding to basic medicine, sometimes you may not be able to find something on the normal high vaginal swab test which is taken from your vagina, then you should inquire or think about recurrent infections and sexually transmitted diseases. Now, what happens is when you take the test for STDs, the most commonest test we use is PCR, and in that you have some of the organisms which may be present. When you have chlamydia or gonorrhea, yes, we definitely say that it is a recent infection and sexually transmitted. So in that case, you can doubt or you can have your partner checked up. But the purpose of discussion today was that sometimes you come across some infections like ureaplasma or mycoplasma. Ureaplasma is one of the bacteria which is present normally in men or women, okay, and it may multiply and it may, but the mode of transmission is definitely sexually transmission. Now what happens is, in such cases we cannot 100% guarantee if they are present that there is some recent issue or something, and sometimes you don't even need to treat those if they're by chance picked up, that you went for screening, you got the test done and it showed ureaplasma, but you don't have any complaint, you don't even need treatment, okay? So the only main issue is the main bug like chlamydia or gonorrhea. It needs to be treated immediately. Trichomonas, yes, but ureaplasma and mycoplasma, there has been different theories. According to patient's complaint, we have to treat it. We discussed about it is because most of the patient come and ask, when I tell them and I do not treat them, they have queries what can be the possible side effect. So normally the STDs, they can give a lot of trouble, like for example they may give you chronic infection which may go up in the uterus, in the tubes, in the ovaries, okay, even in the tummy sometimes, and cause severe pain and other issues. They can be the cause of infertility. They can be the cause of adhesions in the tummy. So things get stuck, okay? And you may, because of those things being, stuck and jammed with each other, you may feel that, you're having chronic pelvic pain or period pain, very severe one. So these are the basic complications which lead up to infertility, which lead up to your risk being high of having other STDs like HIV, herpes, or even syphilis. So whenever you are picked up with one of these, you become a high-risk patient. So we would like to examine about the other STDs, and also we would like to test your partner as well. The treatment in STDs is always, remember, should be side by side with you and your partner both together at the same time. Because if you're treated, your partner may pass it on to you again. So whenever you're treating yourself for STD, remember that the treatment at the same time should be for both of you, and you should have a protection, so no intercourse should be allowed during the treatment. So this was a little short detail about STD problems, but the most important thing is that it's unfortunately one of the common problems which is usually delayed and not picked up early. So it's better to be more suspicious and treat when you know that there's something or recurrent discharge or not responding. It's better to treat it rather than saying that no, I don't have any issue, no, it's okay, women get discharges. So these myths should be clarified. Physiological discharge needs to be separated from the pathological or the problematic discharge. I hope this topic helped you a little bit, and keep in touch. I'll keep posting little small videos for you guys just for information. Thank you so much. Take care.